In previous video we have discussed about hypertension definition and what is the blood pressure and what are the normal values and what is the renin angiotensin aldosterone system. Now we are going to discuss about the types. What are the types in hypertension? There are two types are there, primary hypertension and secondary hypertension. Primary hypertension, there are 90 to 95% of people are in primary hypertension only, because and primary hypertension also known as essential hypertension, and mostly it occurs to all adults. And why? Because this primary hypertension causes means through genetics, like family history of hypertension, then dietary patterns, then who are eating more fat foods and all those type of patients will get, and cholesterol foods. Then lifestyle habits, these are very important, like smoking. If the person is smoking, the nicotine will be attached to the blood vessels. The nicotine will attach to the blood vessels and it obstructs the blood flow, and like this it constricts the blood vessel, so automatically the blood pressure will increase. We know that if it constricts, the vasoconstriction will happen, then the increased blood pressure will the blood pressure is rising. Then drinking alcohol, it directly narrowing and tightening of the blood vessels. Then coming to stress, when people are in stress, there is a sympathetic nervous system. I told that sympathetic nervous system, it causes also vasoconstriction. Then coming to overweight, we already know, if overweight means their plaques and fatty cholesterol plaques will be there in blood vessels, arteries, then it obstructs the blood flow and it raises the hypertension. Then coming to enough exercises, why? If we are not having not enough exercises, if we are not having enough exercises means during exercises our heart also will becoming more strong. Then the heart can pump whatever the demand of body, like how much demand the body asks, the heart can pump that much demand of oxygen and blood to all our body. So if no proper strong heart, and if heart is very weak, then the heart won't able to pump that much blood to all over organ parts. So this is the reason why if we are not having enough exercises, it can leads to this. And eating too much of salt, this indirectly will occur, like if eating too much of salt contains sodium chloride. If sodium chloride increases, then what will happen? If sodium chloride is increasing, then fluid overload will be there in our body. Then fluid overload again increases the vasoconstriction. So this is the reasons why primary hypertension will occur. Then coming to secondary hypertension, these are 5 to 10%. Like if person is having any other conditions like renal problems or endocrine problems means pituitary gland problems, and then neurogenic problems like sympathetic nervous system and vascular problems. If patient is having suffering with any um, vasoconstriction, in previous video we have discussed about migraine. In that, vasoconstriction, vasodilation will be there. Like those conditions also, this secondary hypertension can cause. Then sometimes we don't know what is the exact reason, and some side effects of some medications also. This secondary hypertension can caused by some medications. Then dietary pattern, then some stimulants like antidepressants also sometimes may increase the hypertension, and it leads to secondary hypertension. Then over the counter medications, and if you are taking more medications continuously, then also it leads to then obstructive sleep apnea. When during sleep we are unable to take proper breaths, that time also this blood pressure will rise because of no oxygen supply. If no oxygen supply in our blood, like in our body, the every organ needs oxygen. So the more blood it demands, the every part will demand more blood. Then in that, if obstructive sleep apnea, in that oxygen is less, what will happen? Again vasoconstriction and the blood pressure will rise. Then hormonal abnormalities like aldosterone abnormalities, if it is like that, then also it leads to the secondary hypertension. Then some thyroid abnormalities also can leads to secondary hypertension. These are about the types and their causes. Then coming to normal clinical features. Actually, if hypertension is having in any person, it won't show effects particularly, like it is a silent killer disease, and some people can have severe headache if the bp is very high, and the blurred vision, sometimes they may not able to see, and the vision also will be blurred, and dizziness will be there, nausea, vomiting, fatigue, shortness of breath, because the enough circulating will not be there to every part, then automatically the oxygen may not able to supply all over the body, then shortness of breath can also occur. Then coming to diagnostic tests, like which are all tests if can tell us that the patient is having hypertension, is blood pressure measurement like a sphygmomanometer. If continuously repeatedly like 1 to 2 3 days, and thrice or 4 times in a week, like that, if you are checking in a month like similar frequency and in a same intervals, then we can come to know. Then ambulatory blood pressure monitoring, if patient is in moving and while sitting, while standing, if the continuous blood pressure monitoring will also help us to know whether the patient is having hypertension or not. Then echocardiogram, it sees the heart valves and heart muscles, whether those muscles and arteries like are in good condition or not. Then electrocardiogram, ECG waves also we can come to know, because PQRS waves will be there, and this wave shows the diastolic how much and the systolic pressure how much, it can represents the blood pressure also. Then blood and urine test also, and in urine test sodium and protein, and if any amino acids are secreting through this, we are able to know in these tests. Now coming to management. Coming to management, there are two types of managements are there, like non-pharmacological management and pharmacological management. Coming to non-pharmacological, there are what we have discussed in risk factors, like other than genetics, like lifestyle modifications and all. If we are correcting those things, definitely we are able to control and we are able to maintain the blood pressure in normal ranges. So like lifestyle modification, if we are changing, we are becoming habit of doing exercise and all, then that also will help us to maintain a normal blood pressure. Then maintaining a healthy weight, then it also helps. Then decreasing salt and sodium intake, this also can prevent overload. Then tobacco and smoking cessation prevents attaching of uh, nicotine nicotine to blood vessels. Then limit alcohol consumption, then reduce the tightening of and narrowing of vasoconstriction. This we can reduce through limit, if we are limiting the alcohol consumption. Then limit fat intake, it can also attach the plaques. So if you are making limits to take less fat means, then it also help. Then control diabetes in a normal range. These are the non-pharmacological management. Coming to now pharmacological management. Just I will explain brief about this classification, and in another video I will explain what are the diuretics, what will happen, what these diuretics will do, and renin-angiotensin system and inhibitors. Then now coming to, there are three types, like this antihypertensive drugs divided into three classification. Like one is diuretics, renin-angiotensin system inhibitors, then sympathetic inhibitors. Then again in the diuretics, thiazides, loop diuretics, and potassium sparing diuretics. In the thiazides, hydrochlorothiazide, chlorothiazide, and indapamide. Then coming to loop diuretics, furosemide. Mainly we know that we heard Lasix. It's 4 mg we will get. Now 4 ml. Then potassium sparing diuretics, in best example is spironolactone and aldactone also. Then eplerenone, then amyloid. Then coming to renin-angiotensin system inhibitors, again this divided into three. AC inhibitors like angiotensin converting enzyme inhibitors, then angiotensin receptor blockers, then direct renin inhibitor. So these are in angiotensin converting enzyme inhibitors are captopril, enalapril, lisinopril, peridopril, ramipril, quinapril, trinidoprid. Then angiotensin receptor blockers, like enzyme is, if we stop the enzyme, sometimes we may unable to stop the enzyme. In that time we can block the receptors, like this enzyme. If enzyme is passing through another place, there is something that receiving. So if we are blocking that receiving thing, then we can also stop this converting, like angiotensin 1 to angiotensin 2. So these are the drugs: losartan, candesartan, valsartan, telmisartan, and iribacat and olmesartan. Then coming to directrinin, aliskiren. Then these sympathetic inhibitors, again these are divided into 4: beta adrenergic blockers, alpha plus beta adrenergic blockers, alpha adrenergic, and central sympathetic. Then in this, propranolol, metoprolol, atenolol. Then coming to alpha plus beta, labetalol, clavidolol. Then alpha adrenergic, prazosin, terazosin, doxazosin, fintolamide, phenobenzamine, and central sympathetic, clonidine and methyl-dopa. This all, which are all actions, mechanism of action, why we are using these many medications, that I will going to explain in the next video. And now I hope you understand all about until what I have said. Thank you.